Hi, my name is Justin Griffin. I'm a family nurse practitioner student at United States University. I'm going to be doing a full body musculoskeletal exam today. Can you tell everyone your name?
My name is Tori McCoy.
And do you consent for me to do this video with you
I consent.
and to put it on YouTube and for my teacher to grade?
I also consent.
Okay, so the first thing that we're going to do is always inspection. We're going to start with the hands and then we'll work our way up the arms. So looking at the hands, you're looking for erythema, you're looking for clubbing, you kind of look for calf refill, you're looking for any deformities, anything that sparks you as not good, warts, so on and so forth. After looking for them, you also then want to palpate. So when you palpate, you're touching the distal phalanges first, going to the medial, going to the distal. Then you're looking at the metacarpals. Any pain with any of those?
No.
No, so no pain with any of those.
No.
Then we're going into range of motion. When we're going to range of motion, you want to have them put just their fingers down and up. That's flexion and extension. You want to have them open and close them. Good. That's adduction and abduction. Then you want to make a good fist. And if you want to get real good, you can actually do opposition. Have them touch each one. Those are all really good. From here, we're going to go right into the wrist. Again, looking at the wrist. Throughout this exam, if I just do one side, know that I am doing both sides, but for purpose of time, we're just doing one side. So when we're looking at this, you're looking at the wrist itself. Is there, again, any deformities, anything out of shape? Does your ulnar bone kind of stick up more? Again, looking at the backside, is the redness, is the swelling, is the erythema, any lesion scars, so on and so forth. I don't see any, so I'm not so worried about that. Again, when you palpate, any pain?
No.
No. Again, we'll do the other side. Palpation?
No.
No. Again, so no pain there. Then we go right into range of motion. Again, taking the wrist, flex down, extension up, side to side. Good, that's lateral, and then circular motion, either way. From here, we're going right into the specialty tests. So you turn it over. There's two specialty tests that we're going to do. One is the Tinel's test, and that's when you're going to tap the medial side of his wrist, and if there's any pain, this is consistent with carpal tunnel syndrome. So any pain there?
No.
Any pain there?
No.
Good. Then the next one is the phalangeal test, and you're going to put your hands like this at 90 degrees and hold it there, or you can kind of bend them this way and hold them for 60 seconds and see if there's any pain going on at all. Any pain with that?
No.
No? Good. Coming down. Next, we're going to go right into the elbow. So again, you're kind of looking at the underside. You're looking at the overside. So you are kind of getting the forearm and the arm in here as well. You're looking at the ulcer cranin process. Anyways, you're looking for this bulge. Starts with an OCLENNON. Process, and that's what everyone really considers the elbow there. Then you're looking for the medial epicondyle, the lateral epicondyle. With the medial epicondyle, if there's a lot of pain in here, that's really indicative of baseball elbow. And then on the other side, the lateral side, that's tennis elbow right there. Again, you're going to do that on the other side. I don't see any lesions or swelling or erythema, anything bad. Everything looks good. Everything looks symmetrical. Nothing looks more swollen than the other side. That's all good. From here, we're going to go right into range of motion. So going up, going down. Good. Again, the other side, going up and going down. So again, that's flexion and extension. Those look good for him. And if you didn't notice before, I was palpating earlier here and the backside here for any tenderness. Did you have any tenderness while I was touching you?
No.
Good. Then from here, we want them to do what's called pronation and supination. So you're going to flip their hands up and over, up and over. Good. And that is a range of motion portion. From here, we're going to go right into the shoulders. So you're going to kind of look up at the shoulders again, looking for asymmetric. Make sure there's not side to side. make sure one's not bulging out. Make sure you don't have like the clavicle kind of sticking out at you. That's there. From there, you're finding the clavicle and you're going up to the shoulder. I'm sorry, I was doing that for the neck kind of area. If you look at the shoulder, you're going to make sure that it's not like dislocated and not coming out of the socket. There's no redness, it's not swelling. From here, you find the clavicle, go all the way up to the top. This is the acromion process. From the acromion process, you're actually going to go down. This will be the tubercle of humerus, and then going below that will be the subdeltoid bursa. Going inward from right here, this will be the bicep groove, and coming in more a little higher right here, this is your coracoid process. That probably tickled you a little bit, I'm sorry. So you're touching and feeling all those areas to make sure that there's no pain. You do the same thing on the other side again. With him, he didn't have any pain, no pain, right?
No.
No pain at all. I'm not suspecting any for him. He hadn't had an injury, hadn't had any other problems. From here, we're going right into range of motion. So the first one that you want to do is you want to get them to flex their arms. First at 90 degrees, straight up, and then all the way to 180. Good? Come back down. And that is flexion. If you go back up with me, sorry, and then you go inward like this is external rotation. Come back up. Bring your arms all the way down, right behind you. But all the way behind you, this is extension. Bringing your arms inward to the body, this is internal rotation. So those should be all okay. For him, it's okay. Next, we're going to go right into the specialty test, where we're going to do the can test. Take your arm all the way up. Show the thumb down. Put my hand on the acromion process, and then I can put pressure going down. Any pain with that?
No.
No. So no pain means there's no rotator cuff tear. We're not worried about anything. We're not worried about anything too bad. Next thing we're going to do is we're actually going to bring the arm shoulder across. Good, and this is adduction and pull it all the way away. This is, I'm sorry, this is ABD. This is, I'm sorry, ADD, which you're adding to the body, and ABD going away from the body. Right. Next, we're going right into the neck. So when you look into the neck, again, inspection, we're looking to see if you have any erythema, any goiters, anything that's on the side. You can even check for jugular vein distension while you're here. But for musculoskeletal, we're really not looking for that. From here, you want to check the paraclaviculars, which is the muscles back here, cervicals, and then the cervical in the back, which is the spine itself. These are the muscles. Then you can touch the trapezius. Then you're going to touch the rhombus in the back, and then you can touch the supraclavicular right in here. Any tenderness, any pain with any of those?
No.
No, I didn't suspect there were going to be any. From here, we're going to do all the range of motions again, which is your lateral. Right, good. Ear to shoulder. Rotation, side to side. Good. Flexion going down. Extension going back. Good. Any pain with any of those?
No.
No. So from here, we're actually going to go into the specialty test, which is the Sperling's test, which is when you're tilting it back, extending it back, kind of tilting a little bit more to the side. There you go. If there's any if there's any pain or in one specific spot, it could mean like a fracture. But if there's radiculopathy or tingling going down the arm, that's going to mean that there's like a pinched nerve or herniated disc. You can put your neck back. And then the last thing we're really going to check, which I forgot to palpate for earlier, was we're going to check for the TMJ, which is you find the tragus, which is the little ear part of the ears, and you put your finger there and have the patient open and close their mouth twice. 1, 2. You want to make sure there's no popping or grinding or irritation there. If you do, you might need to, see oral or dentist or ENT. From here, we're going to have the patient lie down and we'll have a look at his toes. All right. So again, inspection. We're looking to see if he has any kind of redness, erythema, bunions, corns, warts, anything that's abnormal for him. Again, cyanosis, clubbing of the toes. I don't see any of that. His are perfectly good. There's no big swelling on either side. Then you palpate, starting on the distal phalange and moving your way down, and then you go into the metatarsals here. And I don't see anything touching, any irritation, anything wrong with that. No pain. You might be a little ticklish. We'll do that. Then you're gonna we're gonna look for plantar fasciitis. Kind of touch back here. This is the Neuromeroma Morton's neuroma. Any pain there?
No.
No. All right. From here, what we're gonna do is we're gonna go and do range of motion. With these, you want to do active and passive. So we're going to do passive first, and what we're going to do is we're going to take his foot and pull it upwards. This is dorsiflex. Pull it downwards. This is plantar flex. And then circle it. Good, and you're again doing this on both sides. And this is, and those are all the range of motions. You didn't have any pain with any of those?
No.
Good. Then we're going to do them again. So pull your toe up. That's dorsi. Pulling down is plantar flexion, and then do a circular motion. Good. Any problems with either of those?
No.
Good. From here, we're going to go right into, I want you to see if you can internally and externally rotate your ankles. Internally, externally rotate. Any problems with those?
No.
No. And then we're going to check for Achilles tendon. We're going to check for, I did the toes and I forgot to do the ankles. That's why I'm kind of going back. I apologize. And then we're kind of looking at the tarsals, see if there's any grinding, any pain while we do this. Any pain at all?
No.
Okay. And that. Have your toes, flex your toes down, flex your toes up. Good. I guess you could really check out Babinski's if you really wanted to here. But we're not going to do that for him. Next, from here, we're going to go right into the knees. First, again, inspecting them. They don't hurt. They don't look bad. There's no swelling or erythema. They both look the same size. One's not higher than the other. Look good. From here, we're also going to look for the suprapatellar pouch, or this we're going to palpate suprapatellar pouch here. Then you're going to check the sides. Sorry, he's very ticklish. And then slightly going up here, you're going to check for the patella fossa in the back. And this is checking for a Baker's cyst. So you're looking for to see if he's got any bumps or anything like that back there. And he doesn't. And again, you would do the same thing on that side. From this, you would then kind of have the patient bend his knee. Good. And then kick up. Kick back down. This is flexion and extension of the knee. He did it the first time, so normally I kind of do the passive range of motion myself, and there we go. Now from here, we have 5 big, or 5 specialty tests that we do. One is the vulgus, which is when you take my hand, it's going to go medial, and then above on his kind of causes up above his knee, and then you have my other hand going on the tibia and the fib on this on the lateral side of his leg, and then I'm going to apply pressure on both ways, kind of going opposite of each other. And what's this checking for? Is this checking for elasticity? And he doesn't have that. And then on the other side, you're doing the opposite. So I'm going to pull here and push here, and that's your varus. So it's checking for the same thing. It's checking for any elasticity or any pain while we're doing it. From here, we're going to go to the Lockman's test and bend the patient's knee to about 20 degrees. Have one hand stabilized over the lower femur, and the other hand on the tibial above the tibial deprosity. And then you're going to push and you're going to pull. Any pain with that?
No.
No pain. Good. And that's checking for your PCL. See if there's any problems with your ACL or your PCL. From here, we're going to go right into the drawer test. This is when you put them way up to about 90 degrees. You're going to put your 2 fingers just like this. and you're gonna below the knee, and you're gonna push in and pull out. When you push in and you pull out, you're checking to see if there's again any elasticity, if it's gonna move. But with this, it's not really doing anything. It's staying right where it should be. It's not too bad. Then the last one we're gonna do is the McMurray's test. This is when we're gonna medial rotate the. Bend it. Medial rotate the leg, and then have the patient push out. Go ahead and push out. Good. Any pain with that?
No.
No. Good. And that's a negative test for that, which is what we want. From here, we're going to go right into the hips. You have looking at the hips. They look. He is kind of kitty cornered, but they are symmetrical. One's not higher than the other. It doesn't look like he's at any pain. Doesn't look like there's any deformities on the side here. Everything looks all right. There's nothing I'm worried about kind of coming out of his shorts or above his shorts there. From here, you want to go right into palpation. So you want to look at the anterior superior iliac spine, and that's right up here. He is super ticklish, so I'm going to do this quickly. You want to do it on both sides. Then you have the trochanter head, which is here, which is the furthest lateral kind of point that you can find on this side. Here, there's no tenderness. Then you'll have him turn. Then you're going to find the posterior, iliac spine, and which is right up here. And then you're also going to find the. You're going to look for the sacroiliac joint, which is with the SI joint, which is right up here. It's kind of like where the button is on like surfers or somebody like that. Since I have him in this position, we're going to do 3 out of the 4 tests real quick. So the first test is, if I have it, we'll do it with me, range of motions, of course. We're going to have me kind of lift him up and going down. So the first one is abduction, going away from the body. I lift up, go down. Go ahead and do that yourself. Lift up, go down. Good. Extension. I'm going to take it, and it's going to come back towards me. All right. Now I'll let you go ahead and do that. Extension. Good. And then flexion is when we're pushing forward. And I'll let him do the last one right there. We'll stand up in a section. You do the same thing with the other ones. But then what we're going to do, we'll do the same ones with his other leg. But let's get him to, next we're going to get him to flex his knee. Trying to go right back to your back here. Flex your knee to a 45-degree angle. And then you're going to inwardly and externally rotate this. Good. Now see if you can do it yourself. Inwardly and externally. Good. And then the last thing, since we got him here, he's actually doing pretty good. We're going to ABD, abduct his hip, going in, coming out, and go ahead and do that for yourself. Going in, coming out. Good. Then we'll have him, since we've gotten all this done, we'll have him go ahead and stand up, and we'll do his spine. I'm sorry, we have to have you lie down just for a quick second. We didn't do the specialty tests, which are the Thomas test. You have the patient's leg, you flex it, have him bring it all the way to his chest, all the way to your chest, all the way to your chest, and hold it firm. And then you're looking at his left leg to see if that lifts up. If it doesn't lift up, we know it's not indicative of lordosis. Then the last one you're going to have him do, which is the Patrick to the Faber test. And this is when he has, I take the left leg, I pick it up, turn it to the side here, put it on his knee or right above his knee, and then I take my other hand and I push down. You want that to go below the other knee. If it doesn't go below the other knee, then you're not doing it. If it doesn't go below the knee, you're worried about sciatic nerve problems, or you're worried about just flexibility in general. Now we'll get him to stand up. Go ahead and stand up. We're going to inspect the spine. Let's see if we get up here. All right, we're kind of going to be down here. So first thing we're going to do is we're going to inspect the spine. We're going to look at his symmetry here. His shoulders don't go up, his shoulders don't go down. They're both symmetrical. Next, you're going to look to see if there's any deformities going down, like an S shape. You're going to look to see if his kind of butt comes out, like lordosis. For that, he doesn't show anything that I see. From here, you can have the patient bend down, and again, you're going to look for good curvature of the spine. Gosh, this is hard to do. Good curvature of the spine, and you know it looks good while we're doing this. You're gonna have them go all the way down and touch the toes, good, and then come back up. And his spine, when he went down, it was when he went down, it was perfect. He didn't have any problems or pain or anything like that. So we'll get back to that's flexion, but we'll get back to that in a second. From here, we're going right into palpation. So I'm going to take the ulnar part of my palm. I'm going to tap, going down. Does that hurt?
Yeah.
No? Good. And then you're going to do the intercostal vertebrae going down, kind of tapping in between each thing. Any pain there?
No.
Good. Then what we're going to do right now is we're going to go right into range of motions. So we're going to have the patient bend. Go ahead and bend forward. This is flexion. Good. And then we're going to see how well he can bend. See how well he can bend back first. Go ahead and bend back. Good. And 60 degrees is normal. He did much better than that. Now we can just do a simple bend back. Good. Then we'll do lateral to the right side. Lateral to the left side. And then rotation. Left and right there. Sorry. We're gonna, this is last thing that we're gonna do here is we're gonna do the especially straight leg raise. So we'll have him lie right back down for the very last thing. Lie right back down, and we'll just have him lift his legs up. Go ahead, lift his legs up. There's one just like that, and ooh, you can't see it. Right. Go ahead and he lifts his legs up and put it back down, and that will be the end of my exam. Thank you very much.